going to talk about a nationally consistent approach to the accreditation of institutions and their HRECs. First, I would just like to acknowledge the First Nations owners of the lands in which we're all meeting, and pay respect to their elders, past, present, and emerging. Sorry, that's better. So this project is something that is under the aegis of the Commission, the Australian Commission on Safety and Quality in Healthcare, and it is associated with the clinical trial framework, the governance framework, and it also relates to something that Rob Lobley said a little earlier in the chat, and that is that health institutions in the future, and perhaps already, will have to submit their own HRECs for accreditation when the institution is accredited by the Australian Commission on Safety and Quality in Healthcare. So those various drivers are some of the reasons why this project has come about. I am purely involved with the Ethics Committee Advisory Group, which is advising the CTPRG, as was the Clinical Trial Project Reference Group, which has now become the Intergovernmental Policy Reform Group, just very recently, with the appointment of the new chair, Ian Chubb. So I'm just involved in a really quite a small part of a very much bigger exercise. I want to particularly thank Dr. Michael Swarbrick and Dr. Bernadette Alaprandi Costa, who have been responsible for all of the work associated with this, at least till now. And the slides that I'm going to use today come from them. So thank you very much to both of them. I think we all know some of the history of the challenge related to ethics review duplication in Australia. The national statement talks about it, of course, and says that it is important to minimise unnecessary duplication of ethics review because of the impact it has on commencement of research. And this has been a driver for a very long time. So initially the harmonisation of multi-centre ethical review initiative, which was undertaken by the NHMRC, resulted in the certification exercise for human research ethics committees around the country. And it was expected that something like the 250 HRECs would be whittled down to a relatively small number, because certification would mean that only a few really needed to be operating. Well, it hasn't quite worked out like that. 42 organisations have been certified and continue to be so. And these were certified specifically to provide single ethical review of multi-centre research, with an eye mainly to clinical trials. In 2013, the public health jurisdictions agreed that this was a good idea and wanted to assist by establishing national mutual acceptance arrangements for certified public health sector HRECs, and a whole tranche of standardised documents and statements and templates were created to support that. The issue has been, unfortunately, that the benefit of certification in the NMA has not really been realised as it was hoped. And the reasons for this are not entirely clear, but two are believed to be the lack of confidence in the initial ethics review and its applicability at local and jurisdictional levels. And that has meant that institutions have requested their HRECs should provide a further review. which of course is entirely against the purpose of the whole thing. The NMA operates via a memorandum of understanding signed by health departments, and it's been, as I said, realised that it's not working to the extent that it should, and so there have been discussions ongoing for a very long time, nationally, across all governments, to come to agree to expand the scheme, and the Australian Commission on Safety and Quality in Healthcare was asked to lead that project. So importantly, the proposed accreditation scheme has support of all jurisdictions, and it accompanies, as I said, the other work led by the now IGPRG. And it is worth restating, and certainly it was what was hoped would occur with certification, that by requiring adherence to a quality standard, it would enhance the consistency and efficiency of review, and mean that institutions didn't need to worry that something was missed effectively. There is another aspect to it, and that is that it gives an opportunity to promote accountability because of the degree of regulatory oversight and compliance. And I think, I don't know what that will look like, but I think the support of the Australian Commission will be very important in determining that. There is another aspect to this, and that is that, certainly my hope, that the accreditation standards will be something to which any HREC can aspire, and at least to benchmark themselves against. So the intention is not to keep this confined to the public health setting, but to spread it further. These are I'm not going to go into these. These are the guiding principles agreed by the CTPRG. Now as I said, so those are the standards the principles that would apply to any standard that is developed. So, what is quality? That for me is really the nub of this whole exercise. How do we determine that an ethics review has sufficient quality? And I'm not quite sure that it's easy to do. I think the plenary we had yesterday morning was fascinating because it dwelled on many of these points, didn't it? Just how do we determine a good review? And a lot of it is procedural. I'm not necessarily a great fan of procedure and policy, but on the other hand, it makes it clear what is expected of institutions and their committees. So a lot of work has been done to try and determine what quality is and how accreditation would work. And again, Michael and Bernadette have been very instrumental in this. There has been systematic review and benchmarking around the world of accreditation standards for ethics committees and IRBs. And there's been the identification of criteria, common criteria, and factors which support quality. And of course, prominent amongst those standards are those which are already in the national statement. And for that reason, these three standards look at actions which can be referenced back to the national statement. This is the new national statement, 2023, and it seeks to reference what we already do, what we should already do, and in a few instances across these various actions, it refers to perhaps newer criteria for which we may have to look at other references in addition to the national statement. The main one here, of course, being research meets relevant ethical and scientific standards, which is the one we all know well. Under governance and the culture standard, as it's referred to, is the establishment of an HREC, and that is the responsibility of the institution. So the accreditation standards are about accrediting an HREC, but the subtext is, of course, that it is also the institution that is being accredited. It's not just an HREC, and the institution is responsible for that HREC. Something that appears prominently in all the different actions under these three standards, or several of the actions under these standards, is the management of conflicts of interest. And of course, the national statement does deal with this to some extent, but again, thinking about some of the presentations we've seen over the last couple of days, is disclosure of an interest enough in and of itself to mean that that conflict is managed? And that's one of the big questions that we've been struggling with, I think, and which we really need to think about very carefully, because if we just disclose, for example, if we disclose a conflict to a participant in a study, what is the participant supposed to do with that? Are they equipped to determine what that means in terms of the research? So I think it's one of the areas that particularly interests me. It's fine having certain statements about such aspects of research, but we really need to know how to deal with them. The appointment of HREC members by the institution follows sort of very well-known statements paragraphs in the national statement, and these are the new references, as I said, so some might not be immediately obvious to you. There is emphasis on minimizing duplication of ethical review for multi-centre research, again, and this was something that was definitely in the certification standards, but perhaps wasn't done very well. And there will be, as there is stated in the national statement, an obligation to accept external review. The quality assessment of the HREC is something that's perhaps going to be suggested as being an institutional responsibility, perhaps a little more than it's been recognised in the past, I feel. And that might entail trying to think, Gordon, I know you were referring to this also, about national processes for assessing the thoroughness and quality of reviews, perhaps participation of HRECs in joint quality assessment. I think it's a really interesting approach, and I think it would give a lot of confidence about that magic elixir of quality and what it actually means. A further action that is emphasised in these standards is the cultural safety, respect and integrity, and that perhaps goes a little bit further than some of the paragraphs in the national statement, 1.10, 1.11, about respecting culture and beliefs. It perhaps is reflecting some of the other influences externally, apart from in this particular area, but also on any institution, to provide cultural safety training, to provide materials for the researchers, increased community and consumer perspectives. And obviously there was quite a bit about that earlier. And community engagement, and exactly what that might look in terms of an HREC isn't yet clear. Right, okay, so the responsibilities of an HREC again, managing conflicts of interest and what that might actually look like, making very clear decisions and linking that to the national statement is really important. And also the responsibilities of individual HREC members. And that is each individual person deciding whether they consider the research is ethically acceptable in line with national statement guidance. And so perhaps a bit more of an emphasis on that. So at the moment, we are here in the consultation stage. We have conducted quite, well, not me, but certainly the Commission has conducted quite a number of targeted consultations. And the plan is to conduct more. So there will be an expression of interest, which is going out to all sorts of organisations to to participate in some further targeted consultations in the new year. And those are associated then also with a survey. So I would urge everyone who can to register for the updates and to participate, if they haven't already done so, in a consultation. And to do that, if you would please contact the HMR at safetyandquality.gov.au and reference the Ethics Committee Standards Project, that would be excellent. And after those consultations, there will be further development of the draft standards and public consultation. So it's a long process, but I think a very worthwhile one. And one hopes with a good benefit ultimately. So I'll stop there. Thank you.
Thanks, Conor. Look, it is fascinating, and having been involved in the initial development of the national approach to single ethical review, it was clear it was a good start at the time.
Yep.
It has to move on. I'm so glad you mentioned quality, and you know my thoughts on the matter. It's like, you can't really assess what's coming out unless you try and assess what's coming out. But simply registering with the NHMRC or whatever is not going to do the job. I mean, by their own admission, they're not able to support HRECs. I do feel, as I said in the chat, it might be as simple as starting with the same ethics application form that asks the right questions and the CTIQ templates, so we can actually see that ethics committees, have fit for purpose templates. That would be a great start. And I'm hoping that the Commission will take those sorts of things on board.
Yes.
Because, just going around the peripheries as institutional processes is okay, but it really doesn't, as we know, deal with how the HREC makes its decisions and how we can have confidence in them. So great presentation though, Conor, thank you. I must admit, it's always been a bit opaque to me about what exactly the Commission was doing. So I think that was a very necessary and timely prezzo. Let me just see if there's any questions from anyone for you. Quality of HRECs, that's from Rob, blah, blah, blah. Sat in another HREC discussing first in human study. I was not definitely confident they did a good job. Know exactly what you mean, Rob. Not too many questions, unfortunately, Conor.
No, that's fine. That is fine.
It's 20 past anyway,